Welcome to the Bitesize Reload New Ways to Connect presentation. My name is Chiara Cecchinelli and I'm the Teaching and Learning Support Librarian at Royal College of Surgeons in Ireland. Today I'll talk you through our latest project regarding the Bitesize program and how we adapted it to create a higher engagement. First of all, Bitesize. The name was chosen many years ago to establish a memory connection in our audience with the BBC Bitesize, a free study support tool offered to school-aged students in the UK from the late 90s. RCSI Library provides extensive and as comprehensive as possible coverage of information literacy topics through many LibGuides, as well as guaranteeing one-to-one help with private consultations all year round. In this environment of continuous information, though, some users might find themselves drawing in knowledge they can structure consistently. One universal truth is that all students learn differently, and it is in our role of educators to help them find their way to internalize content. The Bitesize program was then imagined as a complementary learning support that would have been beneficial to the wider RCSI audience. From 2017 to early 2023, Bitesize consisted of a program of 2 sessions per month. These were optional drop-in 30-minute sessions hosted midweek at lunchtime. The unfortunate time was set to accommodate the multiple lecturers the students were busy with. The whole advertising revolved around a Twitter post a week before the date and a Canva-designed image published on the students' newsletter, usually crammed between the Gym Teams event and the Students' Union updates. Twitter was also used to advertise anything coming from the library, and the many reposts from other major RCSI accounts made the Bitesize advert one in many. Bad timing and poor advertising didn't help with attendance, which usually scored a sad 0, with the librarian delivering the session to an empty classroom, physical or digital. So why deliver the session anyway? Because our stats would consistently show that good numbers of students would later go watch their recordings. Before this new academic year started, my team and I decided to stop and rethink. The Bitesize program was indeed useful, but wasn't living up to its full potential. What could have we done to fulfill it? After weeks of meetings and many cups of tea, we were ready to start new. This year, Bitesize is wearing a new shiny clothes. We have planned a bi-monthly release of pre-recorded content on our Moodle page, each time followed by hybrid Q&As. Every month will be themed, and teams will follow a logical progression of the information literacy knowledge in timely manner with the academic curriculum development. The communication team, with the help of the Teaching and Learning Library Assistant, will plan an effective advertising campaign that won't be relegated to a lonely post on Twitter and will be part of a bigger structure. Teaching and Learning Support Librarians have already started advertising the new social media platform used by RCSI, Instagram, in order to ease and ensure a smoother communication between the audience and the library. We are keen to ensure full accessibility to our sessions, which is why we are going to record visual material with added audio complete with captions. Our videos will follow a clear schematic pattern with recognizable milestones in an easy and comprehensible language that will explain step by step what is shown on screen. As said before, all students learn differently, and RCSI has a large population of foreign students who are used to a different background education system. The hybrid nature of the Q&A will provide a chance for both on-site and off-campus students to interact with the library and ask for guidance or advice. The pre-recorded content will contribute to the knowledge bank in use of the customer service team, which will be able to better support email and live chat queries by instantly sharing accessible and comprehensive content. Let's see together the positive outcomes of our project. The new structure allows a higher level of interdepartmental collaboration with the communication team, the customer service team, and the ERC Education Research Clinical team working together to ensure the best result. Adding another point of contact between the wider public of RCSI and the library that is both in person and online will give more chances to multiple categories of users to reach out. Q&As won't just be relevant for undergrads and postgrads, but will be accessible to clinical tutors, PhD students and staff both on campus and in hospital facilities like Beaumont and Connolly. The release of short and themed pre-recorded content gives the users the option to progress within self-paced learning, lowering the pressure of a live lecture and allowing a slower and repetition-based acquiring of the information. Finally, RCSI tries to be as environmentally conscious as possible. To avoid further waste, the physical Q&A will be advertised on-site reusing old Ask a Librarian banners, and the user will be encouraged to download the videos on their devices to reduce our digital carbon footprints. That brings us to the end of the presentation. Many thanks for your time and attention today.